Hello.
Hello.
Good morning. Premature babies born this year are facing potential health risks from a common virus that's especially active this time of year. RSV is a virus with similar symptoms to the common cold, but it can be more severe in preemies because of their underdeveloped lungs and weaker immune systems. Joining me now are Jennifer Degl, a mother of a premature daughter, and Dr. Paul Checchia of Texas Children's Hospital to share the health risks premature infants may face heading into the winter months. Good morning.
Good morning.
Good morning.
Now, first, Dr. Checchia, what is the definition of prematurity, and is it common in the United States?
Well, a normal pregnancy lasts about 40 weeks gestation, and any child that's born at 35 weeks or earlier is considered premature. So if we use that as the definition, there are about 500,000 premature deliveries in the United States alone each year, and if we look worldwide, that's 15 million premature deliveries every year.
Oh, wow, that's a lot. And Jennifer, as a mother of a premature child, you have firsthand knowledge of the unique health needs high-risk infants require. Could you share what it was like when your daughter was born prematurely?
I can. It was quite terrifying. My daughter was born at 23 weeks gestation, which is about 4 months early. She weighed 1 pound and 4 ounces, and she was not even as long as a ruler. So you can imagine how tiny she was. And aside from all of the medical interventions, minor surgeries, blood transfusions, having a breathing tube down her throat for a few months, what you really want as a parent is to hold your baby and to comfort them. And when you have a premature baby, that's not going to happen for some time, and you end up having to talk to them and sing to them instead of in your arms, behind plastic and more staring at them, and that's really difficult on parents.
Oh, wow. And Dr. Checchia, why are premature infants at high risk for severe RSV disease? Can you tell us more about the seasonal virus?
Well, each year, about November and lasting through March, RSV travels in the community. It's called respiratory syncytial virus. And in older kids or adults, it can be just a bad cold. But for infants, all infants, but specifically premature infants, or those with cardiac disease or chronic lung disease, it can be incredibly severe. And that's because those last few weeks that we talked about when it came to that last bit of development, that's when the lungs get their last growth spurt, as it were, and then you also get antibodies delivered from mom to help fight infections. And so if you shortchange that, premature infants are at greatest risk of getting RSV, which then will attack those immature lungs, and then lead to a very severe disease that can end up back in a hospital, back on a ventilator in an intensive care unit, and there's even a high mortality risk of children dying with RSV.
And now, Jennifer, what advice do you have for parents of premature infants to help protect their children from RSV?
So we were given excellent medical advice from my daughter's pediatrician, and the number one thing I would say to do would be to wash your hands and sanitize your hands very frequently, definitely before you pick up and hold your baby, because you may have germs on you that you don't realize. And also to continue cleaning your home a little bit extra than normal, washing surfaces, doorknobs, remote controls, things of that nature that are frequently touched that may have germs on them so they can't be transmitted to your baby. But also some more difficult things like having conversations with your family and friends who want to come to visit you and welcome your baby and hold your baby. You need to talk to them and ask them how they're feeling, which can be uncomfortable. But if they have any symptoms of a cold or a sore throat, while they might appear minor to them, those viruses can really be damaging to all newborns, particularly premature babies. So they have to be aware not to come to your home if they're sick at all.
That's great tips and advice. And lastly, are there any resources that parents can get more information from on RSV and prematurity?
Well, I think the best resource is to talk to their pediatrician, since they know your child's medical history the best. But we all love to go onto the internet, and one website that's actually has a lot of great information is called rsvprotection.com, and that's a great place to start to answer some of those questions.
Thank you so much for that. And for more information about prematurity and RSV, as well as useful resources, visit www.rsvprotection.com, as well as visit your doctor. Thank you so much. It's been a pleasure.
Thank you.
Thank you.
Have a wonderful day.
You too.
You too.